Welcome, everyone. Thank you for joining us for today's CITI program webinar. Today's topic is ethical and policy challenges for performing xenotransplants under the FDA's expanded access and compassionate use pathway. And it is presented by Doctors Karen Maschke, Elisa Gordon, and Michael Guzmano. Just a few quick notes. This webinar will be recorded, and the recording will be available on the CITI program's website. This webinar is also for educational purposes only. It is not designed to provide legal advice or legal guidance. You should consult with your organization's attorneys if you have questions or concerns about the relevant laws and regulations that may be discussed in this webinar. In addition, the views expressed in the webinar are solely those of the presenters. Now, let me tell you about today's presenters. Karen is a senior research scholar at the Hastings Center and editor of the journal Ethics and Human Research. Her work focuses on the ethical, regulatory, and policy issues involving the development, assessment, and use of new biomedical technologies. Elisa is a professor in the Department of Surgery and the Center for Biomedical Ethics and Society at Vanderbilt University Medical Center. She is a medical anthropologist and trained in clinical medical ethics. Her scholarship focuses on transplant ethics, health disparities, and treatment decision-making. Michael is a professor of health policy in the College of Health at Lehigh University. He also serves as the Associate Dean for Academic Programs and the Director of the Center for Ethics at Lehigh. His scholarship focuses on health and social policy in the United States and internationally. And now I'm going to pass the mic to Karen.
So there are 4 learning objectives for today's session. Define the U.S. Food and Drug Administration's expanded access compassionate use pathway for patient access to an investigational medical product. This could be a drug, a biologic, or a medical device. Describe the xenotransplants that were performed using the expanded access compassionate use pathway. Identify ethical concerns about informed consent for patients obtaining a xenotransplant under the expanded access compassionate use pathway. And describe ethical and policy implications of expanded access compassionate use xenotransplants for first-in-human xenotransplant clinical trials. Now, 2 patients received a pig heart. Both recipients lived about 2 months post-transplant, and 2 patients received a pig kidney. The first recipient lived about 2 months. The second recipient was a little bit more complicated and unique. She received a heart pump first, and then a few days later received the pig kidney.
The elements of informed consent that must be disclosed to patients considering expanded access or compassionate use for xenotransplants are quite similar to the elements disclosed for research studies.
A key difference between the expanded access program and clinical trials is that expanded access uses are not primarily intended to obtain information about the safety or effectiveness of the drug. This is according to the FDA.
And finally, I invite everyone to review our content offerings regularly, as we are continually adding new courses and webinars that may be of interest to you all. For example, our Technology Ethics and Regulations course covers various technologies and their associated ethical issues and governance approaches. In addition, you may be interested in our Bioethics course, which provides an overview of major bioethics concepts, principles, and issues. You can learn more about these courses and others at citiprogram.org. In closing, I'd like to thank Karen, Elisa, and Michael for today's webinar, and our audience members for joining us today and for your great questions. And that concludes our webinar. Have a great day.